Daniel Jones exits today's game with a lower body injury on this play. Hi there, my name is Dr. Stephen Wilson, and here on this channel we analyze the science of sports injuries. So if that's the type of content that interests you, then please consider liking and subscribing to this channel. This is the replay from Sunday when Daniel Jones exits the game with a lower right leg injury. On the replay, when we watch it at full speed, he releases the pass and then goes down to the turf clutching his lower right leg. And on the replay, when we actually analyze it here, what we're going to see is the rotation and what's called an eccentric loading force of his right Achilles tendon. In this moment, when he's about to release the ball with his right hand, his right foot is externally rotated, his toes are pointed to the outside, and then as he rotates through, we're going to see a rotation of his ankle and his lower leg, and that's going to occur with his toes in what's called a dorsiflexed position, with his toes more pointed up towards his knee. And as he pushes to release that football, the propulsion of his calf muscles firing, trying to plantar flex, which is bringing his toes down towards the ground, that's going to place a significant load on the back of his calf muscles. There's three main muscles in the back of your calf that all come together to form your Achilles tendon complex. And in this motion, with that rotational component combined with a dorsiflexed foot pushing down into that plantar flexed position, that's going to place a tremendous load, a very significant mechanical burden on his Achilles tendon. As we walk through the replay here, he's going to release with his right hand. There's that rotation of his foot, and his foot going from a dorsiflexed position, which is in the maximal lengthened position of the tendon and the muscle, going down into a plantar flex position of what we see here, with his toe pointing downwards just like that. That is going to place the load on the back of his calf, where his Achilles attaches into the back of his heel, or his calcaneus bone there. When you contract or forcefully contract a muscle when it's in its fully lengthened position, that is going to place a lot of stress on the bony attachment point. On the anatomy screen, we're going to take a look at the lower right leg. We'll pretend this is Daniel Jones on the field on Sunday. We're looking at his ankle and his foot and his lower leg of his shin bones. Right now we see from the lateral point of view, this is his fibula superimposed on top of his the larger shin bone, his tibia here. When we saw Jones release the football with his right hand, his foot and his ankle rotated. Now, your ankle is a hinge joint. It likes to go back and forth in flexion and extension. When you add a rotational component to that, that's going to place additional stress onto those soft tissue attachments. And when he was throwing, remember, his foot was in dorsiflexion with his toes pointed up towards his knee, and as he releases that football, that propulsion of his toes coming downwards into the opposite motion, that's going to place a stretch onto the back of his calf muscles, his gastrocnemius, his soleus, his plantaris muscle. Those are the major movers in the back of your calf. They come down and attach into the back of the heel bone, the calcaneus here. And when you have a forceful sudden contraction with the muscles in a fully lengthened position, that's going to be very, very difficult on the soft tissue attachment. The Achilles tendon extends down, attaches into the back of the heel. In this position, Daniel Jones certainly is at risk of at the very least a calf strain, and the fear at this point is for a ruptured or torn Achilles tendon. Thank you very much for watching. I appreciate your time today. Please be well.